Selamat pagi. Hello and good morning, ladies and gentlemen, our online viewers. Selamat datang ke sesi nih-cme Continuous Medical Education untuk tahun ini, kali yang kelima, brought to you by Sektor Sumber Maklumat Penyelidikan Pejabat Pengurus NIH. Hari ini, kita ada bersiaran secara langsung di nih-MOH YouTube channel. So, kindly subscribe and klik the bell button untuk dapatkan maklumat terkini berkenaan update-update terkini tentang sesi kami. Jadi, for your information, nih-CME is a platform for NIH researcher to share their research findings to the public. On today's session, our discussion would be on understanding mortality using death count to explain disease epidemiology, changes in health system and human behavior during COVID-19 pandemic. Tuan-tuan dan puan-puan di atas talian, seperti sesi sebelum ini, sila daftarkan diri anda di link yang telah disediakan di comment section, dan juga sekiranya tuan-tuan dan puan-puan mempunyai sebarang soalan, boleh hantar melalui Google Form yang telah disediakan. Jadi, sebelum kita meneruskan sesi kita pada hari ini, mari kita sama-sama saksikan informatif video yang ataupun video korporat yang dibawakan oleh Institut Kesihatan Umum.
Malaysia is currently facing the double burden of communicable and non-communicable diseases. Together with lifestyle risk factors, which pose devastating consequences on population health. Population-based data is vital for monitoring of health status of our population, while indirectly evaluating various strategies and programs implemented by the Ministry of Health. The Institute for Public Health, or better known as IKU, is one of the research institutes under the National Institutes of Health, Ministry of Health Malaysia, that spearheads national epidemiological research, with the goal of supporting evidence-based policy making, through public health research and regular population-based surveys.
We started as a training institute in 1967 and changed our main focus to research in 2005 with the establishment of the National Institute of Health, NIH. As one of the research institutes under NIH, our main functions are conducting research, training and consultancy. Our niche area is community-based survey, and we are well known for our National Health and Mobility Survey, or better known as NHMS. These surveys were done at regular intervals since 1986, targeting different topics and target population.
IKU aims to strive further to become a leader in health survey in Malaysia, and to achieve this, IKU formulated 6 key strategies. IKU value knowledge as a commodity to be shared, and continuously disseminate the research findings. IKU disseminate research findings to the stakeholders through various presentations, technical reports, fact sheet highlights, and infographics. At the same time, IKU published research findings in various scientific journals and presentations at scientific conferences.
Our officers also provide consultancies in various research-related areas. For this, I'm proud to note our expertise were recognized by numerous agencies locally and internationally.
In ensuring to provide a comprehensive health-related population-based data, IKU established 7 centers that mirrored image public health divisions at the Ministry of Health. Family health, communicable disease, non-communicable disease, nutrition epidemiology, burden of disease, occupational health, survey research.
And HMS scopes were based on either age groups such as maternal and child, adolescents, and older persons, or health-related scopes such as non-communicable diseases, communicable diseases, and nutrition.
Apart from that, IKU also conducted other national survey and burden of disease study. IKU is also actively involved in interventional study, also conducted, development, and validation of new research tools, as well as a systematic and scoping review.
To produce quality research, we must adopt cutting-edge technologies. Facilities in IKU are equipped with research-critical equipment and systems to ensure that we produce quality research output.
Through the years, IKU has significantly enhanced its capacity as a research institute. IKU achievements can be seen through his contributions to the key performance indicators set by the top managements. We strive to be the center of excellence in epidemiological and survey research through conducting high-impact research in supporting the Ministry of Health for evidence-based policymaking.
Selamat kembali ke rancangan kita. Sebelum kita mulakan discussion kita pada pagi ini, saya ingin mengucapkan selamat datang kepada Dr.Shubash Shander, Ketua Pusat Tinjauan Penyelidikan Institut Kesihatan Umum. Selamat Dr.
Thank you, Ani. Good morning.
Good morning. Jadi, as an introduction lah, mungkin boleh kenalkan diri kepada para penonton dan mungkin latar belakang tentang penyelidikan yang kita jalankan dekat IKU.
Okay, my name is Shubash Shander. Saya seorang medical officer by training and public health researcher. Saya dah about almost 8 years bekerja di Institut Kesihatan Umum, NIH sini. Bidang kajian saya banyak melibatkan survey research analysis, metodologi untuk general survey dengan juga untuk any research. Dan saya banyak zoom kepada bebanan penyakit dan juga kematian. So, yang saya akan sampaikan hari ini dan kajian yang saya akan share dengan semua orang hari ini adalah berkenaan dengan trend kematian semasa pandemik COVID-19 ni. Dan apa yang kita boleh belajar dan macam mana kita menganalisis data daripada kematian.
Terima kasih Doktor. Jadi untuk topik kita yang panjang pada pagi ini kan, mungkin secara introduction kepada para penonton kita, mungkin Doktor boleh jelaskan secara ringkas maksud dan hubungan antara perkataan death dan juga mortality ni.
Okey. Death adalah kematian. Death adalah secara general, kita boleh kata bila orang meninggal, orang mati adalah death. Mortality adalah kematian tapi dia lebih merujuk kepada data dia. Data dia, analisis dia dan kita akan melihat kepada jenis-jenis kematian, mungkin dia adalah spesifik. So contohnya mortality bila kita akan kata dia adalah age spesifik untuk umur tertentu. Sama ada dia untuk sex spesifik untuk lelaki lain, perempuan lain. Dia cause spesifik juga, contohnya disebabkan oleh penyakit jantung, jangkitan kuman. So kita akan tengok sebab-sebab kenapa kematian itu berlaku atau mengikut kawasan. Di Malaysia dia adalah mengikut state tertentu, contohnya di Johor, di Kuala Lumpur, atau untuk kawasan yang lagi besar berbanding negara juga. So kematian boleh dilihat dalam berbagai cara. Antara yang paling common boleh kata kita biasanya tengok adalah maternal mortality. Ini adalah kematian ibu-ibu sebab sepatutnya bila melahirkan anak, ibu adalah sihat, tidak mengalami masalah dan kita expect dia adalah kurang. Kita juga biasanya akan monitor juga infant mortality dengan under 5 sebab budak-budak baru lahir biasanya mereka adalah sihat. Kita akan cuba untuk tengok dia adalah gambaran terhadap situasi kesihatan di sesebuah negara. So, kalau in general bila kita tengok data, bila kita belajar, kita melihat apa-apa di yang ada di media, di TV ke tentang kematian, kematian memang sesuatu yang penting. Dia adalah yang last health outcome boleh dikatakan, yang kita nak elakkan. Kita nak pastikan seseorang tu sihat dan of course seseorang tu bila sihat tak ada penyakit dan juga tidak akan meninggal dengan disebabkan oleh penyakit tersebut. So kita biasanya we say that it is the most basic health data. Kenapa? Sebab kematian tu sama ada dia hidup atau mati. Senang nak ditentukan. And dia juga adalah very basic di mana tak kisah untuk disebabkan oleh apa, disebabkan oleh kos apa. Bila dia meninggal, kita dapat merekodkan dia. Dan kebanyakan negara juga merekodkan rekod kematian. Di Malaysia kita ada akta yang mewajibkan kita melaporkan setiap kematian dan direkodkan oleh Jabatan Pendaftaran Negara. So di Malaysia, rekod kematian kita sebenarnya adalah antara yang sangat bagus, di mana rekod kematian kita adalah hampir-hampir 100% atau 99.7%. Dan maklumat ni, data ni biasanya dikeluarkan oleh Department of Statistics kita, DOSM Malaysia, dan kita mempunyai satu sistem yang cukup bagus. So, bila kita buat kajian tentang kematian, one of the things yang kita usually we take into account that we know when we look at mortality is death mesti akan berlaku. Death adalah sesuatu yang tidak boleh dielakkan, and bila dia berlaku di population yang besar, death akan lebih kurang constant. Mortality akan mengikut pattern yang tertentu. Kecuali ada perubahan disebabkan oleh tingkah laku kita, di situasi kita, environment kita, dia akan menyebabkan perubahan. Dan bila ada sesuatu yang berlaku secara mendadak, the changes are sudden like natural disaster, ada typhoon, ada tsunami, kematian akan berubah dengan cepat. Heat waves dan of course epidemik COVID kita menyebabkan kematian kita meningkat disebabkan oleh faktor-faktor luaran. Tapi kalau kita lihat ada perubahan dalam sanitasi, ada perubahan dalam kesihatan, pemberian kesihatan disebabkan oleh ubat yang baru, cara treatment yang baru. So these things kalau when it happens, it will happen slowly. Mortality akan pelan-pelan akan berubah. Tapi dia tak akan menjadi secara mendadak seperti dalam in a natural disaster. So this makes it that a data, bila kita tengok trend kematian, we can make certain assumptions and we can learn. And we can also learn about the changes. Bila changes tu mendadak, kita boleh baca tu, kita boleh belajar daripada tu. And when we correlate, triangulate dengan different data, we also understand better about what happened. Contohnya di COVID-19, just looking at that, we understand COVID-19 better by looking at the data itself. So, this fluctuation ni adalah penting. We would, and close monitoring is necessary. And to give an example here is, this is that pattern kita di Malaysia, jumlah kematian setiap tahun, dari tahun 2010 hingga 2019 yang dirilis oleh DOSM Malaysia. Yang menunjukkan trend kita adalah quite smooth. Dia akan setiap tahun, dia akan slowly meningkat. Kematian mesti akan meningkat biasanya disebabkan population meningkat. Bila lagi ramai orang, lagi ramai dia akan, mesti yang bilangan orang yang mati pun akan biasanya lebih ramai. But another example here contohnya adalah, we look at death pattern yang berlaku di Jepun. This is one yang I ambil daripada one of the papers. When ada a natural disaster di sini, tsunami berlaku di Jepun, kita boleh lihat macam mana death itu berubah secara mendadak di 3 buah cities di Jepun, termasuk Jepun overall. Dan kematian ni, satu, disebabkan natural disaster tu bila dia laku, contohnya tsunami, dia berlaku lepas tu stop. Dia tak berterusan macam COVID-19. So dia meningkat secara mendadak, lepas tu terus kembali kepada almost normal level again. So that is how death usually works. So what you do bila kita belajar, kita lihat untuk death, and one of the things yang kita biasanya lihat adalah excess mortality. Excess mortality adalah perbezaan yang mendadak tu. Daripada biasa, macam mana dia meningkat atau menurun, ini yang dipanggil excess mortality. So, ini adalah contoh di mana biru tu adalah excess mortality yang kita lihat di 3 buah cities yang berlaku di Jepun semasa tsunami yang berlaku pada tahun saya rasa 2011 ini.
Terima kasih doktor atas penjelasan yang begitu komprehensif sekali. Lepas tu, lepas kita dah tahu tentang death dan juga mortality, kita dah masuk tentang excess mortality kan. Jadi mungkin doktor boleh kongsikan dengan penonton kita macam mana pengiraan dan bacaan data-data tersebut.
Okay. Excess mortality sebenarnya dah bertahun-tahun ada. Dah lama siapa yang buat bidang kajian dalam excess mortality dah, dia is something yang has been there for years. It's not something new. Tapi mendapat perhatian, a lot of media attention, newspapers, articles yang keluar tentang excess mortality semasa COVID-19. So bila dia mendapat perhatian, excess mortality menjadi something yang quite interesting. And also dia adalah, what is nice about excess mortality is actually very simple. Excess mortality kita lihat daripada level-level yang biasa, berapa peningkatan atau positive excess kita panggil, atau pengurangan atau negative excess yang berlaku. So kita lihat perbezaan actual death yang berlaku compared to apa yang kita biasanya akan expect dalam situation tu. So excess mortality in the sense of COVID adalah dikatakan sebagai gold standard untuk melihat macam mana impact atau macam mana beban untuk pandemik tu. Sebab dia menunjukkan kematian, peningkatan daripada biasa, peningkatan daripada tahap yang kurang. And bila kita lihat excess mortality, kenapa dia begitu penting? Semasa COVID, kita semua dapat tengok in media was reporting number of COVID cases, number of new COVID cases, cumulative COVID cases, new deaths, number of total COVID deaths. But COVID death hanya melambangkan kematian yang disebabkan oleh COVID. Disebabkan oleh pandemik COVID ni, ada banyak perubahan berlaku to our daily lives. Tak boleh keluar, nak beli, kena balik awal. Mungkin nak pergi hospital pun susah, appointment dilambatkan. There were a lot of issues that happened semasa pandemic COVID ni because it was a transmission happening and it was a infectious disease. So we are worried apakah kesannya terhadap penyakit-penyakit lain. So bila WHO pun buat kajian tentang COVID-19 ni, excess mortality secara global, kalau kematian disebabkan oleh COVID-19 adalah dalam lebih kurang 6 juta orang telah meninggal, excess mortality diramalkan dalam 15 million people. So that shows you the difference, the huge difference antara kalau kita tengok kematian COVID saja tak melambangkan betul-betul situasi pandemik tu. Compared to when we look at excess mortality, it gives a much bigger picture, much bigger impact of what happened during the pandemic. So what we did untuk kajian excess mortality ni adalah kita ambil data daripada Jabatan Pendaftaran Negara, kita ambil data daripada 2015 dan kita lihat trend dia untuk tahu okey apa expected dia. Apa yang kalau pandemik ni tak berlaku, berapa ada kematian yang sepatutnya berlaku di Malaysia yang kita predict untuk tahun 2020 2021 di Malaysia, dan kita menggunakan time series model. Kita cuba beberapa jenis model termasuk Prophet dengan Arima untuk tengok model mana yang memberikan kita data yang terbaik, graf yang terbaik, prediction yang terbaik. So kita akan ambil data yang daripada March 2015 sampai Ogos, kita check data dia yang mana yang paling bagus untuk meramalkan, dan seterusnya kita guna itu untuk forecast ahead. So this is time series forecasting. Kita ambil data dahulu untuk forecast ahead. That's all. And when we choose the correct model, everything is depending on the model. Sebab bila kita dapat model tu, kita buat perbezaan daripada apa model tu yang melambangkan excess mortality. So that model being correct is a very important aspect lah untuk kita pastikan. So if I can share what we found semasa excess mortality, this is what happened in Malaysia sejak mulanya pandemik COVID-19 di Malaysia. So excess mortality di Malaysia, kita ambil date of start of COVID-19 di Malaysia sebagai March 2020. Sebab first case in Malaysia, if I'm not mistaken, was on the 25th of February 2020. The first case of COVID yang kita report dekat Malaysia. So kalau kita tengok sepanjang daripada March 2020, ada trend dia adalah asyik berubah. Yang kita lihat line biru adalah kematian yang direkodkan. Ini adalah yang betul-betul berlaku. Line yang bermula daripada orange tu, atau orange atau brown, depending on how it looks on your screen. How it looks to you as well. That orange or brown line is what would have been expected. Kalau COVID tak berlaku, we would have expected mortality patterns to follow that. Tapi apa yang betul-betul berlaku, the blue color line, kalau dia di bawah, the blue line is below the orange line, dia adalah kurang daripada expected dan adalah negative excess. Kalau dia adalah lagi tinggi daripada the orange line, then dia adalah positive excess. And kita, untuk senangkan bacaan dia, saya color warna hijau untuk negative excess dan warna merah untuk positive excess. So we can look in general that yang there were a lot of differences. Mula-mula kematian sebenarnya menurun di Malaysia. Kita pada awal pandemik sampai pertengahan tahun 2021, dia adalah negatif 19,000 sampai pertengahan 2021 kita. This was quite surprising. Kenapa kematian menurun di Malaysia? Kita ingatkan disebabkan oleh pandemik, kematian akan meningkat. Orang tak boleh pergi hospital, appointment dah dilambatkan. We all expected it to actually be higher. But data menunjukkan bahawa kematian actually menurun. Kita hanya mendapat kematian meningkat dan meningkat secara mendadak semasa Delta wave kita di separuh tahun kedua 2021 dan juga di awal tahun 2022 semasa Omicron wave. So of course, like how I said, the most important thing bila kita buat forecasting ni adalah betul tak forecast kita. Our model is right or not right. So one of the things yang kita buat adalah kita compare dengan WHO punya model yang mereka keluarkan. WHO ada tim sendiri, mereka mengikut mathematical model yang sendiri untuk mereka. Dan bila kita discuss, we were both sides from Malaysia and WHO, we were very happy that our models lebih kurang sama. Yang penting adalah bila kita kata trend negatif, dia masih negatif. Bila dia positif, dia juga menunjukkan positif. Hanya perbezaan, one major difference is our actual data menunjukkan kematian menurun dengan cepat, while WHO had predicted yang kematian dia slow sikit, dia akan turun. So, it's good to know the model is accurate. When two teams yang independently we had reviewed this work had produced the same results, well, it increases our confidence yang apa yang kita dapat tu adalah betul. And when we look at what we found, like how I said, between March 2020 till June 2021, kita adalah almost negative 19,000. Kematian berkurang sebanyak about almost 20,000 people died less than expected. So this was quite a shocking finding. And we were trying to explain. So this is just not about data, but how we triangulate the data. Data has to make sense. Data has to correlate with other things. Data must be supported by other data as well. So when we looked at this, we looked at all our hospital deaths. Kita ambil data daripada hospital dan kita tengok di mana pengurangan itu berlaku. And kita mendapati bahawa pengurangan ini mainly adalah daripada penyakit jantung, mainly our heart attacks had reduced, our diabetes has reduced, diabetes deaths, dan juga kematian disebabkan oleh penyakit paru-paru kronik dan juga jangkitan kuman di paru-paru. Both heart attacks and jangkitan kuman paru-paru, pneumonia, are some of the major, the number 1 and number 2 causes of death di Malaysia. So bila pengurangan berlaku dengan ketara in these two areas, this led, and for a sustained period for almost 1 year plus, this led to quite a large reduction in the number of deaths yang berlaku di Malaysia. So we know that penyakit NCD, our penyakit tak berjangkit yang banyak berkurang, penyakit penjangkitan kuman di paru-paru yang berkurang, and we will also double check again, did it happen to certain people, certain groups, was there any weird patterns noted? So kita tengok kematian yang berlaku di hospital dan di luar hospital juga. It was good to know that kematian di luar hospital tak ada banyak perubahan. Kematian pengurangan yang berlaku tu semua adalah kebanyakannya, boleh kata kesemuanya adalah di kematian yang berlaku di hospital. So this, we can make a sense that walaupun kita ada pandemik, kita ada lockdown, kita ada movement control, MCO yang berlaku di Malaysia, bila orang sakit tenat and betul-betul sakit teruk, mereka masih boleh akses kesihatan kita. Boleh akses hospital, kecemasan kita mendapatkan rawatan kesihatan. Tidak sampai mereka teruk sangat mati di luar hospital. So that was nice to know. It felt good that we had done something. We had to control the pandemic. MCO perlu. Tapi we had found a good balance between akses kepada hospital dan juga menyekat pergerakan secara banyak untuk mengurangkan penularan COVID tu. And when we looked as well by sex, di antara lelaki dengan perempuan, the patterns were almost the same. We look by different age group, kita mendapati pengurangan yang berlaku tu mainly adalah di kalangan yang berumur lebih daripada 40 tahun, mostly in berlebuh 60 tahun ke atas. So pengurangan ni adalah yang highest risk group yang sebenarnya berkurang. Mereka adalah lagi tua, chances of you lagi meninggal adalah lagi tinggi. Lagi banyak penyakit adalah, it's always the case. So, the ones who were 60 years and plus who are the ones who reduce. And also, bila kita tengok by different ethnicities as well, selama ada Melayu, Cina, India, kita mendapati semua ethnicity juga merekodkan pengurangan di masa ni. So, we are quite confident that, okay, data kita adalah betul. Kita check di semua tempat. We always cross-check data with other data sources. We always disaggregate data, we break it down to look whether does it make sense. And one of the, even though as overall we know the data kind of has a pattern, it makes sense, it follows WHO model, but we were still like, okay, let's check one more thing. Why is it negative? Semua orang kata kematian meningkat. Europe especially, even in US, were reporting peningkatan kematian disebabkan oleh COVID. What is the logic behind it? So we go back and we look at scientific literature. What was scientific literature reported? And this is one example of many. Ada banyak paper yang keluar masa ni yang menunjukkan bila kematian disebabkan oleh COVID adalah rendah, Bila testing rate di sesebuah negara itu adalah rendah, biasanya excess mortality pun akan rendah. This was proven many times in many countries across many time frames. That was the case during COVID. Low COVID deaths, high testing rates will lead in low excess mortality. So kalau kita tengok, Malaysia is listed there as well in this graph, yang menunjukkan this makes sense. Literature supports it, science supports it. Our data is most likely accurate. So this helped us be quite confident about our results and findings. And then we have to be confident about our data and our findings. Then only we can interpret further what we need to do with this data.
Terima kasih, Doktor. Jadi kita dah tengok macam mana data-data ni, nombor yang kecil tu boleh give a huge impact dekat kita punya bacaan kan. Jadi mungkin doktor boleh explain sikit macam mana data-data ni, pembacaan data ni digunakan dalam sistem kesihatan kita.
Okay. Yeah. So data is data, okay? Data adalah number. We want to get the right information daripada data. Kita akan proses data tu, kita akan melihat this is trying to make, kita buat trend, kita dapat graph, kita compare with other data sources, kita dapat more information from it. But end of it, it's all about what kita boleh belajar daripada data kita. Apa knowledge yang kita dapat, macam mana kita mengubah, kita ada impact daripada data kita, apa policy changes that we can do, what do we learn, and what do we do moving forward. So when we look at our data, one of the main things, it was good to know, like how I said, healthcare services kita was not so severely disrupted. That was a good thing. That was something that we were worried about during the COVID pandemic. That was something that it was good to know. And kematian ni adalah berlaku di pengurangan kematian yang berlaku was mainly due to penyakit kronik kita, penyakit tak berjangkit seperti sakit jantung, penyakit kronik paru-paru dan juga jangkitan kuman di paru-paru. These were the main causes, and bila kita tahu these were major causes of death in Malaysia, that through reduction led to huge reduction as well. But we must also look at kenapa benda ni berlaku. So can we make sense? Is this even logical and logical dalam situasi di Malaysia? So this is where we cross-reference to, compared to what WHO doing, we understand Malaysia better. Kita tahu situasi di negara kita. So we look back and we see that yes, eating patterns have changed. People were more at home. Kalau orang tua-tua, caregivers, anak mereka ada di rumah untuk menjaga. So, and that tak ada travel. Kalau you are staying in Klang Valley, you know, not traveling is a huge reduction in stress. Our eating habits, our daily behavior change. A lot of people yang masa pandemik ni berkata tak sempat exercise. Tapi sebenarnya data menunjukkan bahawa 30% orang berkurangan exercise mereka. 30% orang berkata meningkat exercise mereka. Sebab tak payah pergi kerja, tak ada travel time, mereka exercise di rumah sendiri. So exercise pattern actually was lebih kurang sama. But we believe that penggunaan face mask, social distancing and all that also hugely contributed to the reduction of this penyakit tak berjangkit, of jangkitan kuman di paru-paru. All this also led to the decrease. So we believe in the quite accurately that these results were good. We could explain it. We could explain it based on science. We could explain it based on what was happening in Malaysia itself. So if we look forward to it now, the excess mortality, we know that was until mid-2021. Now that was a reduction. Tapi bila Delta wave datang pada pertengahan tahun 2021, it led to a huge spike of deaths. That is shown there. You can see just from the graph how the pattern just shoots up. Okay? Delta wave was bad. Delta wave hit us bad. I think we all knew that Delta wave was bad. So, how bad was Delta wave semasa tu adalah kalau kita daripada awal pandemik sampai pertengahan 2021 tu kita adalah negative 19,000 deaths. By the end of 2021, 6 bulan tu, disebabkan oleh positif 27 kematian yang berlaku, dia dah total up to almost positive 8,000 deaths yang berlaku di Malaysia. This was a huge increase, a lot of people. So generally we would believe yang kata deaths yang berlaku di reduction yang berlaku semasa awal-awal pandemik ni. Orang tu dah memang ada sakit. Mereka ada masalah. Mereka adalah yang paling berisiko bila mendapat jangkitan COVID. Dan bila jangkitan COVID, ada banyak di luar tu, ramai orang mendapat jangkitan. yang berisiko tinggi juga mudah mendapat jangkitan, and they are most likely the ones to also die because of COVID. So COVID has that impact. Even though you dah reduce, but COVID would make you more likely to die because of just how the disease is. So this led to a huge increase, what we also call, if on a technical term, as mortality translation, whereby it just, you saved here, it will happen later. So it's like a displacement of the mortality. So this displacement ni berlaku semasa pandemic, semasa Delta wave yang berlaku ni. And we can look at it as well. We looked at it negative excess, excess mortality kita. Kalau kita plot daripada hanya nombor-nombor excess, sama ada dia negative excess. If negative, we plot below the line. Kalau dia positive, kita plot above the line. Kita lihat pattern dia. And the pattern, macam earlier I said, how excess mortality tends to follow dengan COVID mortality and also testing rate. We found exactly the same thing. It follows almost exactly the number of COVID mortality. COVID cases, not so much. But bila COVID deaths meningkat, excess mortality pun akan meningkat. Our findings continue to be consistent dengan whatever literature that we were reading, the science that we already know. So again, we looked at it. How was this pattern? We divide the data as much as possible to not only, this is, we know kematian meningkat. Did someone be overly affected? What can we learn further from it? How do we triangulate this data? This is where kita tengok kematian mainly berlaku di hospital. That means people were, at least we know these people were coming to our hospitals, able to get some care. They were just so severe that we could not do anything. But at least they could access again. Again, they could reach our hospitals. That was something that was good to know, despite the peak and huge spike of number of cases and COVID deaths that were happening at that time. We found that the deaths were mainly among males. This is usually due to a higher risk behavior. Males tend to go out more, and this behavioral pattern changes would, most cases, most deaths occur more in males. Males are just more prone to die. That's how it works. So mainly the excess mortality happened also among males, and it also happened mainly among the elderly. Like how I said, the saving was most among the elderly as well. Bila the deaths happened, it also happened more. They were also the highest risk of COVID-19 because they were elderly and are more likely to have chronic diseases, penyakit tak berjangkit, and they were also most affected. But one of the surprising findings we found was it was higher among the Malays. For some reason, di Malaysia, dia adalah lagi tinggi di kalangan Melayu compared to the Chinese and Indians. Now, this is expected deaths. Chinese and Indians reported kurang daripada expected. Malays reported lebih daripada expected. Now, that pattern is supposed to maintain. Doesn't matter how many Malays, Chinese, Indians there are dekat country. This is what you would expect to happen. So, when there is a more than expected of about 11,000, we went to dig up again, why did this happen? So, this is where we found that from kajian kita, from National Health and Morbidity Survey 2019, the Chinese actually reported much lower prevalence diorang of non-communicable diseases such as diabetes, hypertension, cholesterol, obesity. They were way lower. And they also had a much better practice of our 3Ws, yang washing, warning and all that. So the 3Ws were maintained, and during early pandemic, kalau kita tengok, all the ethnicities were very high, 95% and above. But even by early 2021, this is before even Delta hit us, the Chinese were still maintaining a very high rate compared to the Malays and Indians. And Chinese also reported a higher risk perception of risk of dapat COVID. This changes a person's behavior, macam mana dia orang keluar, apa mereka berlaku, cuci tangan ke tak. It is a good proxy. So when we look at kajian-kajian lain and try to triangulate the data, we at least get to know that, okay, this is most likely the Chinese were saved, still maintained a negative excess mortality, positive mainly seen among Malays because of NCDs yang ada, and because of their behavior. So being able to triangulate the data is where then you dapat nombor. It is just a data, but being able to triangulate you now gives you a much wider understanding of both your health system, and also you are able to now predict to certain level of accuracy. Ni bukan cakap main-main lah, in other words, but you are able to prove, or at least indirectly prove, that this is because of behavioral changes, that is what that is leading to it. So data is powerful when you are able to triangulate in such a way. But we went further also to look, is this residual mortality? What is residual mortality? Is kita tak nak tengok kita buang semua kematian disebabkan oleh COVID-19, kita tengok untuk sebab-sebab lain sahaja. Because COVID-19 will happen suddenly. But kematian-kematian lain dia meningkat ke tak? Kita lihat kalau untuk even Delta wave yang begitu tinggi before this, kalau kita buang semua kematian COVID, sebenarnya dia adalah sangat rendah. Most of the people at that yang mati waktu itu adalah because of COVID-19. But there will be some spikes. Bila kematian COVID meningkat, there will be other causes as well going up. This is known. This is called small fluctuation and this is normal in data kematian. Kita will never expect a straight, beautiful line. There will be fluctuations. And juga what further can we see is bila kematian begitu tinggi, that means case would have been very high as well. Bila case tinggi, adakah kematian tu meningkat even our small spikes tu yang happen pun sebab hospital kita terlalu penuh. Rakyat tak dapat pergi hospital atau tak dapat admit kat hospital, tak dapat ICU ke. So bila kita tengok bed ratio kita has no relationship dengan the death. Our bed COVID, the amount of users of COVID bed versus non-COVID beds, walaupun dia tinggi, it doesn't affect. It was early way before, but it was much after yang kematian berlaku. And even that follows a totally different pattern dengan our bed usage. So this shows that even our hospital beds, despite the spike of COVID, even though at our highest point, we were still managing it. Our people still could access our beds were being provided extra. Of course, Kementerian Kesihatan sediakan lagi banyak beds and facilities, but dapat menampung jumlah kes and we were able to treat them as best we could. And one of the other things, even though we know vaccination is safe, there's a lot of studies that shows vaccination is safe, but excess mortality or especially residual mortality is another way untuk kita tengok untuk vaccine safety. Remember pada waktu second half of 2021 tu, we were vaccinating about 100 to 200,000 people a day. Kalau vaksin tu had any side effect to cause, let's say people were saying you might cause stroke, might cause a different disease, might cause a cause of death. Bukan COVID tapi kematian sebab lain. Kalau dia 0.001% meningkat pun, dia dapat dilihat di residual mortality. Sebab kematian tu akan jadi 100, 200, 2,000. So bila dalam 2,000 kematian tiap-tiap hari, it would be picked up by residual mortality. So even though there were isolated cases here and there, overall the vaccine had no effect to our mortality pattern. So it's just an indirect one other way to look that our vaccines were not causing deaths. It didn't matter sama ada 2 doses atau booster dose, it had the same pattern that was seen during COVID-19. And of course, end of the day, kita nak tahu juga is how did we fare? In Malaysia, we have to look as well. It's not shock sendiri tengok our own country, we are happy. But compared to other countries, it was good to know yang in Malaysia, our excess mortality daripada mula pandemic sampai December 2021, compared to our neighbours like Singapore and Thailand, we were about the same. Singapore was about 2.3, Thailand is about 1.6%. This is very low numbers. We managed regionally compared to a lot of other countries, we managed it well. Some of the countries that recorded the highest excess mortality, ada countries yang recorded lebih daripada 100%. This is based on WHO punya estimates. And other countries yang, even though negative, usually the negative is not that big. It's about 5% like that. And I also listed some major countries of interest here as well, like India, Brazil, US, yang they were going at 15 to 30% on their excess mortality. So Malaysia, we did pretty well.
Terima kasih Doktor. Jadi Alhamdulillah kita punya nombor cantik kan. Jadi daripada data-data ni macam mana Doktor boleh ringkaskanlah status kesihatan kita terutamanya di Malaysia, terutamanya waktu pandemik COVID-19 tu sendiri.
Okay. If you see untuk ringkaskan, at one point of time I think mainly disebabkan oleh report yang keluar daripada US dan Europe, excess mortality menjadi ramai sebutan media. It became a public issue. In fact, people started talking about excess mortality because that was how they saw how the government managed the COVID. Dia menjadi almost like a report card. Now, personally, I'm against a report card. I will tell you that because excess mortality is not meant to be like that. It's not a one-stop to kata you manage the pandemic well, you didn't manage the pandemic well. There are a lot of other factors. But either way, if you want to give a report card, Malaysia, we did very well. We did a very good rate at 2.1, is considered very low. Our cross data shows that our hospital system, our health system overall was not overwhelmed. Orang masih dapat akses healthcare system kita semasa pandemik ni. And juga peningkatan dalam vaccination yang berlaku, our vaccination rate that peaked towards the end of 2021 probably saved a lot of lives. If we remember, between the WHO model and Malaysia model, I think the reason we came down that fast was because, this is a personal opinion, because of the vaccination that happened that fast and that many, that probably saved a lot of lives. But beyond that, I think what is more important for us to learn from data, from information is how do we move forward. So we know that dealing with NCDs, penyakit tak berjangkit adalah sangat penting. It is not just about your penyakit tak berjangkit, it's not about kematian disebabkan oleh penyakit tak berjangkit, tapi any other infectious disease, any other pandemic, whether COVID or anything in the future, it will have a huge impact to the country, to the health status of the population, to the people. So everyone needs to be educated. We need to give them the power to take care of their penyakit tak berjangkit and NCDs. We need to reduce this in Malaysia. And it also showed the value of practicing our 3 Ws and being careful. Our hygiene and preventive measures are important. And yes, we relax the rules as we open up, which we have to. Those who are high risk especially should continue to practice. Those who live and mix around with people who with high risk should continue to practice this preventive measure because it makes a difference in terms of the number of COVID mortality that was happening, in terms of excess mortality also that was happening. So I think the end goal was that we also learned where to focus on, what to focus on, and a need to actually improve the health literacy, COVID literacy among our population. So just to bring you further, I mean, that was data until end of December 2021. If we look further, data till 2022, we have got the data up to June 2022, mid this year. So mid this year, there were a few things that were good to know. One is, like how early on I said, kematian adalah constant. It happens. It's inevitable. People will die, and it follows a certain trend. So one of the things we noticed in 2022, the pattern has started to go back to its pre-levels. It means, to me, at least to me, it means two things. One thing I'm very happy is, that means the model that we created was accurate because it's going back close to our model. That means as we open up things, as we enter into a phase of endemicity, life has started going back to normal. That's why mortality patterns will also go back to normal levels. We are returning back to life as normal. So that is one thing that is good to know, that is a way to look at which stage of the pandemic we are in. And also another thing that we saw was during the Omicron wave, another period that we had a huge surge of COVID cases in Malaysia, we also had a peak of deaths that happened. But Omicron was a bit different compared to Delta. If we look at between cases and kematian, the one on top is the cases and kematian. Omicron had way larger amount of cases, huge amount of cases, and in a much shorter period it happened. But the number of deaths is way less than Delta. Delta was a lot more lethal variant. It killed a lot of people. It was a dangerous variant that Delta came out. Omicron spread a lot. It went to a lot of people, but it wasn't as lethal. So it was a less severe form of COVID-19. And we continued to do our analysis. We found that, again, it tends to follow the kind of COVID pattern. But we also noticed there were certain gaps there. So these gaps that happened in 2022, it could possibly be because we missed some of COVID-19 deaths, but that's unlikely in Malaysia. We have a very good system of picking it up. But we might have missed out the actual cause of that, is whether COVID-19 or not, because at that time we were using a lot of self-test kits. People were testing at home. This would lead to some level of inaccuracy. So this was something that we need to take into account, changes in the health system. We were not so much COVID-focused. We were opening up. We were going back to life as normal. Everything was still, a lot of other diseases and problems need to be taken care of. So if life goes back to normal, these kind of things would happen. But the biggest lesson to this is that did not cause an increase during the Omicron wave. Our health system was able to cope. The impact was minimal because Omicron was not so bad. So the impact, what was most important take home is, I would say, is the impact was minimal from Omicron wave, or rather from missing that few deaths that happened during the Omicron wave. But we went further on to see as well the deaths happened both increase in males and females. It was higher among males compared to females during that time. Like how I said, that always more in males. Age group, again, it was mainly among the elderly, continued to have the same pattern, no matter at which point of time, the elderly were always the most affected during the COVID-19 pandemic. And also by ethnicity, Malays continued to have a very high excess mortality compared to other ethnicities. So again, one thing that we noticed was there was a slight change in the death registration, whether medically certified are the deaths that occurred in hospitals, non-medically certified deaths were occurring at home. The ones in the hospital were going down slightly. So this was there was more green there and there was more red in the non-medically certified. This when you pakai magnifying glass and you tend to zoom because it's things that you do. You tend to see things, little things. But it was a pattern. We wanted to see, is this pattern significant? Is this pattern have a reason or is it just normal changes, fluctuations that happen? When kita lihat balik data-data lain, we notice that compared to pre-pandemic dan sekarang, right now our number of hospital visits were much lower. Less people were coming to our hospital, less people were coming to our clinics, even though our hospital admissions remained about the same. That means people were accessing our hospitals less. So this wasn't good. Why aren't they coming to the hospitals? Is this the reason why people were meninggal? And we also look at residual mortality. Residual mortality showed a bit of peak. Remember, there was this gap that was there between the excess mortality and COVID mortality. This is probably the peak that was picked up here. And zooming on into the non-medically certified, we believe that peningkatan yang kita lihat di kematian berlaku di rumah, di tempat awam, the non-medically certified or outside hospital deaths. We have three hypotheses why this could happen. One is orang takut untuk dapat COVID. They have a perception kalau saya datang hospital, more likely to get COVID. Ramai pesakit COVID di sana. Kalau masuk, saya sendiri akan dapat. So that delays them seeking treatment. Because compared to early pandemic, kita ada MCO, lockdown, susah nak gerak. Sekarang semua dah buka. But this is the time pula, bila tak ada sekatan, masa itulah pula orang tak nak datang. So this is more of a behavioral issue, whereby we believe that maybe they were afraid of that dapat COVID, or afraid yang bila datang ke hospital, kalau saya ada COVID, saya akan dikuarantin. Dan dah sakit tendat, tak boleh jumpa orang, tak boleh jumpa ahli keluarga, saya akan mati seorang-seorang. These are normal. We know these are behavioral patterns in Malaysia. That's why I always stress, being a local researcher, we understand the context better. So we can triangulate things in a much better way. And also there's a thing called endemic delusion. This is something that has come up recently, especially during COVID. Where you rasa, pandemic dah nak berakhir. Kita dah sampai kepada fasa endemic. So things are better. People take things easy. Even symptoms dia, kalau bukan symptom COVID, they don't think it's serious. So that delays your treatment as well. Mungkin you ada batuk-batuk, you test kat rumah, dia bukan COVID, and you delay it. And end up you ada pneumonia, and this would actually cause a death. So it becomes a kind of a delusion that things are fine. So we look again at vaccination. Vaccination again had no effect onto COVID-19. This was good to know. The booster dose did not cause any spikes and differences. But one thing that I found very interesting is even when endemic was coming, we were talking a lot about nak masuk pada fasa endemicity. And because COVID is new and we never had a pandemic to this proportion in recent times, we fail to realize that maybe what we say as endemic has a different effect on other people. How rakyat, how the population takes this might have a totally different meaning. So we must be careful when we send this message across, and we must send it accurately and see how people then, their behavior then changes because of the use of this word.
Terima kasih doktor, especially di atas penerangan doktor tentang how you make sense from the data kan. Jadi semoga sedikit sebanyak penonton kita dapat ambil iktibar dan juga pengajaran lah daripada data-data yang kita ada sekarang ni. Jadi kita akan ada sesi Q&A. So sebelum kita pergi sesi Q&A tu, mungkin doktor boleh simpulkanlah sedikit tentang death mortality ni dan juga maybe way forward ke.
Okay. So overall, as a conclusion of this whole study, I would say it was good to know the Malaysia up to June 2022 still up to this year, our data still shows that excess mortality has been low. Remember, my first slide, WHO claims that it's the best one to look at the impact of the pandemic. And we have done well in Malaysia. It's only 2.8%. This is good. It's good to know that life is going back to normal. This is supported by returning to normal mortality rates where we enter this. This is life back to normal. It supports that we are going towards an endemic phase in a technical sense. But we need to be careful about COVID. We need to look at the testing rates again. We must always continue to be vigilant about it. Be careful with COVID. And there is some shift of behavior. This needs to be studied further. How people interpret COVID needs to be studied further. So that is one of the reasons I wanted to say today, like how you said. I think what is interesting is we have just the number counts. Kita ada berapa orang yang meninggal. But from that, and we take other data sources, we take what we know, we look at people, we look over time, then we can correlate so many different things. We know how people behaved. We know how a health system worked. We know how that affected our health system. We know what to do for our health system, what to do for the people, for the behavioral changes. And this gives us a much better picture of how to deal with it. To me, that is what research is about. Numbers are just numbers. It's nice when we can make sense. So before I end it, let me just... This is not my work alone. There were a lot of people involved. A huge big thanks to my colleagues, especially to those from Biostats and Data Repository, and as well as Institute of Health System Research from NIH, Dr. Zulfadli, Dr. Iqbal, and Dr. Awatif, who were great help to me. Special thanks as well from Pusat Informatik Kesihatan in MOH and Department of Statistics. DOSM also helped us a lot. And we also got help from Deloitte Consulting during this COVID period on helping us with big data analysis. We used a lot of big data analysis platform as well in order to be able to do our this kajian. Okay, thank you.
Terima kasih Doktor. Jadi kalau penonton kita kalau ada apa-apa soalan boleh contact dekat contact number Dr. Shubash dan juga email lah dekat situ. Jadi sekarang ni kita ada beberapa soalan.
Oh,
Okay.
dah ada.
Okay, dah ada. Saya akan bacakanlah beberapa soalan yang dah ada kat sini. Okay, kita start dengan daripada Arvinder Singh HS. Great research, but we must realize that the death data is only as good as the reporting system. If the reporting system is inaccurate or selective, then we cannot have proper data modeling. Just my honest opinion. Okay, opinion, sorry. Okay, kita akan moving forward.
No, I would actually like to say, I totally agree. I 100% agree with this comment and what was one. And it is actually a very important point, which is why I started off by saying, in Malaysia, we have a law. We don't look at, kat sini, we are not looking at sebab kematian. Kita tengok dia mati, tak mati. Jumlah kematian, that is the main thing in this research. Jumlah kematian di Malaysia is 99.7% is recorded. Almost 100% of that was recorded. That was the first thing that we did actually as part of this research. Is our data accurate? We were confident that the numbers were picking up were accurate. Repeated years, Department of Statistics Malaysia has reported that. WHO recognizes that our collection system is quite accurate. So then only we would move further. If that was not accurate, we would have taken a whole different approach on how to do this. So a good question, something that we considered, something that it is there. So I would like to tell him is the numbers are good, the numbers are believable because we capture quite a lot of it.
Okay, thank you. Okay, soalan seterusnya daripada Dr. Norlaili Khairuddin. Okay, sekejap. In excess mortality analysis, did you consider all COVID-19 related deaths die with COVID-19 and die due to COVID-19? If yes, do you have a data shows excess mortality for cases died due to COVID-19?
Okay. There were two definitions, died of COVID-19, died due to COVID-19. There were memang two definitions. But let's not forget, these definitions, even kematian disebabkan oleh COVID-19, definisi dia keluar pada akhir tahun 2020. Initial part of COVID, it was kept changing because it was new, novel disease. So, what we did was actually semua kematian COVID yang saya laporkan ni adalah daripada open source yang Kementerian Kesihatan keluarkan. Daripada GitHub MOH yang melaporkan, kalau GitHub melaporkan, GitHub dapat data daripada MOH, kalau GitHub melaporkan dia adalah kematian COVID, then it's a kematian COVID. So I take a open source data, semua kematian as officially reported, semua kematian COVID as officially reported, this is what that was used. So we don't look at the difference of because of COVID or due to COVID. And again, because of COVID, due to COVID has some impact. We are currently doing analysis to look at the costs, different causes. That is a whole different, that's a lot of more, it's because there are a lot of different causes of that. That takes a bit more complex analysis to do that. But this, when we look at it as general, I think the most important thing is the trends of it. Which shows that, well, even though COVID-19 went up or down, what was important was that the total deaths went up during the pandemic. Early part was negative, and then during the waves only it went up.
Terima kasih, Doktor. So, soalan seterusnya daripada Puan Rosnani binti Misiran. Mengikut pengalaman anda, apakah perubahan paling sukar dalam tingkah laku manusia yang pernah anda hadapi semasa menghadapi pandemik dan juga semasa proses endemik ini? Pastinya terdapat perbezaan kan? Okay, so your opinion.
Oh, that's macam soalan Viva dah tu, exam pada pendapat anda. Okay. That's a tough one. Okay, first let me give you a disclaimer. I am no expert in health behavior. Okay, which is why I have my team also consists of people from health system research, and I did consult with health behavioral research team for their opinion during the findings and all that. I'm no expert in this. But if you ask me on a personal basis, what would be my opinion, the most difficult thing is, in COVID, changes happened easier because everyone were talking about it. COVID was a new disease, people were scared of dying. The biggest difference, the hardest thing to do is the long-term difference. Telling people to exercise, telling people to jaga makan, telling people to kurangkan berat badan, telling people to continue taking their medication, telling people to stop smoking. This is so much harder because the effect doesn't come every day. You see it and kita dah almost biasa. It is normal to eat a lot. It is normal to not exercise. People need to understand that this has a huge impact. Not this, your gaya hidup, cara hidup yang sehat, trying to change this has the biggest impact in your life. Doesn't matter whether a pandemic is happening, not happening, future, now, or because of the penyakit tak berjangkit itself. This is a behavior that people need to change, and I think that is the hardest that we are trying to do the best we can from Kementerian Kesihatan to push people towards adopting cara gaya hidup yang sihat.
So, kita hampir ke penghujung rancangan. So, maybe ada last soalan daripada sini. Mengapa hari ini kita masih kurang memberi penekanan pada bab kesihatan selepas peristiwa COVID-19? Contoh mudah, pemakaian pelitup muka. Masih ada yang mengambil ringan perkara ini, adakah kerana satu bebanan atau kerana kurang menitik beratkan perkara ini? So, expert opinion.
Again, expert opinion is a big word. But I would not say kita kurang memberi penekanan pada aspek kesihatan. I don't think that is a fair statement to give. We do di Kementerian Kesihatan in general. In Malaysia, we do give a lot of emphasis towards health behavior being there. During COVID-19, our health system worked, I don't know, overtime, double, triple overtime to get the system going and being able to serve. And similar to that, I think Kementerian Kesihatan has always maintained wear your face mask. But at some point of time, you need to also be able to tell when do you push it, when do you not push it. When do you force it, when do you not force it. So the approach we have taken is right now our COVID cases, especially like even we saw during the Omicron, cases were high, but deaths were low. Cases were high, but most of it were mild cases. We were trying to give the best health care to them. Make sure that they remain healthy. Our hospital system were not overloaded because of it. So do we have to force the people to still wear masks? We stopped forcing it. What we did was we encourage it. We continue to educate. I think Kementerian Kesihatan has not gone away from that statement where if you are high risk, please wear your mask. if you are in a closed environment, if you have a lot of people, if you, especially you yourself, are uncomfortable, please wear a mask. Those are things we continue to emphasize, and that has not changed at all in my opinion. And honestly speaking, I wear a mask. If I'm in a lift, I wear a mask. If I'm in a room full of people, because I'm just uncomfortable. I think we need to accept the fact that this is not about what kerajaan can do or Kementerian Kesihatan can do. This is an aspect kesihatan that people need to take on upon themselves. So that's why I think part of my presentation also was emphasizing on health literacy. Health is your own responsibility. Your health is your responsibility. You take the right measures. You do what is necessary to maintain your health. If you are healthy, health system will be very happy. The country will be better. Everybody will be happy. I think it's in your hands. That's what I would say.
Terima kasih Doktor. Jadi kita dah habis kepada sesi soalan kita. So semoga para penonton kita di luar sana sedikit sebanyak dapat mengambil beberapa informasi barulah daripada pembincangan kita pada hari ini. Dan ingat tanggungjawab dan kekalkan kita punya penjarakan sosial.
Kita pakai mask.
3W tu kan. Jadi itu semua bukan tanggungjawab kementerian dan kerajaan semata-mata, tanggungjawab kita sebagai individu juga. Jadi sekali lagi saya ucapkan terima kasih pada doktor. And then kepada penonton kita kat sana, jangan lupa untuk subscribe dan juga untuk ikuti kita punya sesi CME yang seterusnya. Terima kasih.
Thank you.